There are certain provinces that are facing higher stats than that. Let's get some perspective now from Dr. Aslam Dasoo, a convener from the Progressive Health Forum. Good evening, Doctor. Thanks very much for your time. Do you think that we are heading for a second wave, already in a second wave?
No. A second wave would imply that we have passed the first wave and that we are now going into a second bout of infection arising from a seasonal adjustment, which normally happens with respiratory viruses like this one. What we are seeing now is on the surveillance is a significant uptick in the number of cases. As you're aware, we were at a peak around July, August, came down to quite low numbers, but that means that the infection is still active, circulating in communities. To the extent that the numbers are low, we have to understand that there has been some immunity developing in communities, and the interventions of non-pharmaceutical interventions, I should say, have been possibly slowing down the infection. But what we have now is an uptick, and this uptick, I think, is something to worry about, but it is not the second wave. We are seeing a resurgence, effectively, of the first wave.
I see. So is it because people are getting too complacent, not wearing their masks, and we're on level 1 and we all think it's over?
Yes, that may well be the major cause for this. It's eminently possible, because what we are noticing in society is a greater degree of complacency around these non-pharmaceutical interventions. So let me just make this point. These non-pharmaceutical interventions are the only instruments we have in our toolkit to slow down the rate of transmission and to control it, not to eliminate it, and until we get a vaccine, which will get us to what is often termed herd immunity. But until that happens, these are the only measures we have. Wear your masks, keep your distance, wash your hands frequently, avoid crowds, stay in well-ventilated places. Now, these are very simple measures to take, and it's quite remarkable that a large number of people throughout the country don't seem to be able to either understand it or to take it as a worthwhile recommendation. It is absolutely crucial that we do that. The one thing we don't want is a lockdown. And I'm very concerned that the government is talking even about it. A lockdown is no longer part of the toolkit. It really never was, certainly not the lockdown we had. And it's really problematic if the government is moving in that direction. I heard the premier of one of the provinces basically threatening people.
It was Convener, I think. Yeah.
Yes, basically threatening people. It's not appropriate to threaten the populace with a lockdown in order to enforce compliance. What you will get is quite the opposite. You will get defiance and non-compliance. And I think we're seeing that. So there has to be a different approach taken to communicating these measures that we have to, all of us, undertake at this time.
Absolutely, and we are hearing that we may hear from the President sometime this week. People worried that he may announce another lockdown. We're certainly nowhere near needing to change our restrictions, in your view, or are we?
Absolutely not in terms of the lockdown. In fact, we should actually eliminate any thought of it and move even out of stage 1. The reason I'm saying this is that when we introduced the lockdown in the first place, what we did, all that we did, was simply delay the onset of the expected curve. So we got all the infections anyway.
Yeah.
But the collateral damage has been devastating.
That's true.
The economy has been shredded, and people have really felt a great deal of hardship. Now, the President acknowledges that whenever he speaks. But in the lives of 50 million, 60 million people, you know, words are not enough. Livelihoods have been lost. And with that, you will also get an increased mortality rate, perhaps even greater than COVID can give you over time.
And thank you very much for your views this evening. You make such an excellent point, really. We simply cannot countenance another lockdown, so we have to just do the things we need to do. And thank you so much. It's wearing those masks, it's social distance, it's washing your hands. We've just got to stick at it. Thank you very much. That was Dr. Aslam Dasoo, convener from the Progressive Health Forum.